Very good morning, students. Namaste. I'm Dr. Shruti Mishra. I'm Assistant Professor at Vidyapeeth Women's University, Jaipur. Today, we will going to discuss about the health and safety of employees in the industrial relations and basically in the uh, 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 at the setting of the organization. So, how the organization deals with the employees' health and safety measures and the provisions. So over the past century, the companies in our country had to make the enormous changes in the how they treat their staff. So there are still many companies that try to find out the other way around the duties and administration outlines for them to follow. The federal laws that are engineered to protect all the staff may appear completely out of the place in the varied work settings, but the primary goal is to ensure that the health and safety at the work for all the ones that are employed. So under the safety and the health law, the first responsibility for that is to down the companies. As the employees, as an employee, as an organization, it has a duty of the organization that they look after the health of the employees and the safety at the work for the others as well. So now let's look upon the what type of safety and the health measures are required at work. So all the employees must know the rights and responsibilities regarding their safety at the and the health at the work. They should be aware about the general laws applicable to them. All the employees have known about the entertainment breaks and the paid vacations. If they are sick, if they are off from the duty, or they are sick they are sick and they are off from the duty, then they need to find out the practical information or what there can be done. In the case of the corporations that produce the large items in the health and safety at the work for their staff may involve the right foot gear, shades, and the protectors and other protecting appearance. So these are the basic requirements which should be there in the organization. So health and safety at work for those in the medical field involve the proper disposal of the dangerous waste, ensuring the centralized uh, areas from the patient after the patients have used them, and consistent private cleanliness to avoid the spreading contagious. So basically that's the basic requirement. uh, Now, what should be the organization role or the management role in employee safety? There should be a proper designing of the safety items, that safe and healthy system should be there. Strong management commitment should be there, that they should be dedicated towards the employees, that employee safety and welfare. The third one is they need to inspect that the workplace for the health and safety problems, and they need to establish certain type of procedures and control for dealing with them, the health and safety issues. So that's the basic requirement for the organizations. Now, what is the supervisor's role in the employee safety? Supervisors must monitor their workplace frequently to identify the unsafe and unhealthful conditions, to take the prompt action to the correct hazardous condition. The third one, if the serious hazard, to take immediate interim action to safeguard the employees. Next one is to encourage the employees to report the unsafe and unhealthy full conditions, and last one is to seek the suggestions from the employees for the improvement of the workplace conditions. So these are the most important part which need to be followed by the supervisors. There are certain acts as well. As we know, there are Factory Act 1948, Maternity Benefit Act. So these all should be there. Act says that there should be proper urinals should be there, crutches should be there, restrooms should be there. So canteens should be there. There should be some kind of officer should be there, that they need to check out that what exactly the employees are having a problem related to certain welfare issues or certain health and safety issues. So these things, these problems need to be identified by the organizations, and they need to be clearer by them as well. So that's the basic requirement. Now, benefits of the safety and health and healthy workforce is the higher productivity that increase the efficiency and the quality, reduce the medical and insurance cost, lower the workers' compensation rate and payments, and last one is to improve the reputation of the as an employer of the choice. Now, next is the consequences of an unsafe and unhealthy work environment. Injury and diseases, that is the back injuries are the most prevalent exposures to the chemical that also happens. Mental health is a problem that the psychological symptoms can affect the productivity and the life away from the work. Deaths and violence and the economic cost, these are the certain things which make a consequences in the among the employees life. Now, what the external environment says about the health and safety measures in the organizations. Global organizations are International Labour Organization, that is one, that is called ILO, International Labour Organization. Other one is World Health Organization, that is WHO, as we know about it, right? So they try to strengthen the international and the national policies, develop the practices for improving the health at work, promote the health at work and through the technical assistance and the support, develop the human resource for the field of the occupational health, and establish the relevant and the useful registration and the data system, raise the public awareness and strengthen the research of the occupational health. Workplace safety and the health hazard. So occupational accidents, there are certain type of occupational accidents are there. Occupational accidents are the working conditions and the time that the factors most affecting the occupational accident, that is the working conditions and the times and tools and the technology available to do the job. So there are, when there are certain type of not very good or up to the mark facilities are available there, or the tools are available there, so the accidents may occur, right? So this is basically occupational disease. We can also study about it. That is a disease causing the hazards. That is a coal dust, due to the coal dust, due to the benzene, due to the uh, coke oven emission, due to the cotton dust, due to the lead radiation, vinyl chloride. So these are certain things through which the problem may occur. The occupational disease may occur. Workers most likely to be exposed in the chemical and oil refinery workers, miners, and the textile workers, steel workers, medical technicians, painters, shoemakers, plastic industry workers. So these are certain things. Diseases are linked to the workplace hazard, that is it may cause the lung disease, it may cause the leukemia, it may cause the bronchitis, it may cause the lymphoma, it may cause the central nervous system damage, reproductive disorders, and the skin diseases. So there are certain type of things which happen due to the when there are not proper measures are available there in the organization. So this is basically about the health and safety issues which happened in the organization and which should be there in the organization for the employees. So that's all for the day, students. This session is powered by Digital Vision 2.0, Jyoti Vidyapeeth Women's University, Jaipur. Thank you so much, students. Have a great day.